Hello, my future millionaires. Today's topic, we're going to go over why you don't actually need health insurance, contrary to popular belief. If you haven't already, please hit the subscribe button for more videos. According to the Kaiser Family Foundation, the average price for health insurance plans for single people was around $7,500. And for families, it was $21,500. Now, that's just the insurance. That doesn't include any of the copays or the deductibles that need to also be paid in addition to the medical bill that the insurance would be paying. On a side note, up until the age of 26, you can actually be under a parent to be covered under their health insurance, even if you're married, even if you're not living in the same house, and even if you're not going to school. For those of you who don't have that luxury, you might be thinking, well, Danish, I've heard that you can go bankrupt if you don't have health insurance and if you have a medical emergency. What do you have to say to that? Well, I am an advocate for smart savings and having an emergency fund that you can control instead of giving all that money to the insurance company. Now, you do have to weigh the pros and cons of how likely you're going to have medical appointments as well as needing medications and whatnot for the year. If you and your family have major health concerns, then not having insurance may not be right for you. It really depends on your situation. But if you and your family are otherwise healthy and are going to the doctor for routine visits, then it's actually going to cost you quite a bit more to have insurance. According to debt.com, hospitals cost on average almost $4,000 per day. And each hospital stay averages about a little under $16,000. Now, something you may not actually be aware of, and something that's usually not spoken of. Did you know that the cost of hospital charges being so exuberant is actually the cost that hospitals agree to with the insurance companies and what they would be, the minimum that they would be willing to take from those insurance companies? This may not be the case for all hospitals, but most hospitals are businesses in the U.S. So what exactly happens if you don't have health insurance and a big bill comes up? Well, first off, if you can, plan ahead for any medical appointments you have or you may have, you or your family, for the year. Find out how much the self-pay cost is for those appointments. If you are unable to plan for something big, then ask the hospital or facility billing department if they can decrease the amount that you owe, as they have the ability to write off any and all amounts. They do it all the time for insurance companies, so why not for the people who actually need it? And if they are not willing to decrease beyond a certain amount, and if that amount is something that you are still not able to handle, they may send to debt collectors. That does not actually hurt your credit, as they are essentially private agencies buying debt accounts off of each other in hopes of you paying them eventually. You may try to negotiate with them, but I would not recommend giving any personal information such as your social security number, etc., because that can be used against you. And this process can take about 2 years for debt collectors to cool down on, so you may be getting a couple calls consistently, but after that 2-year period, it does tend to go down. I hope you found some value in this video, and if you did, please hit the like button. It would mean a lot to me, and please hit the subscribe button for more videos. Thank you so much for watching. See you next time on Dan Daily.